This is your demonstration class on heart. This is the specimen of heart along with some other associated structures like these sheet-like structures. This is the fibrous pericardium along with the parietal layer of the serous pericardium. Visceral layer covers the heart. Now, this is the arch of the aorta, descending aorta. So, there must be a portion known as the ascending aorta. In front of the ascending aorta, this is the pulmonary trunk. So, if we retract the pericardium, then this is the ascending aorta lies below the right auricle. This is the right auricle. Right auricle is the ear-like projection arising from the right atrial chamber. This is the left auricle, and rest of the heart is the ventricle. This part is the right ventricle, this portion is the left ventricle. So, heart presents 4 chambers. Now, what are the presenting parts? It is a conical muscular organ. So, this is the apex of the heart. Immediately opposite to the apex there lies the base. This is the way to show the base. You have to place your fingers and 3 borders. One is right border, one is inferior border, another is left border, and 3 surfaces. One is sternocostal surface, one is diaphragmatic surface, another is the left surface. So, you have to stretch your left palm and put the diaphragmatic surface, flat diaphragmatic surface of the heart on your palm. So, how to hold in anatomical position? The diaphragmatic surface is below and sternocostal surface looks forwards and towards the right, and apex is directed forwards, downwards and to the left. This is the anatomical position. So, see, you have to place the diaphragmatic surface, you have to identify the diaphragmatic surface is flat and apex is directed forwards, downwards and towards the left. Now, again, you have to discuss the detail about the borders and surfaces. So, you have to identify this is the superior vena cava, this is the right atrium. So, this is the superior vena cava, and at the same line this opening for the inferior vena cava. So, if you join the right margin of the opening of the superior vena cava and inferior vena cava, this is the right border of the heart. Right border heart extends from the right margin of the opening of the superior vena cava and inferior vena cava. Here presents a sulcus, another sulcus terminal. Next, the inferior border starts from the opening of the inferior vena cava and the sharp margin and up to the apex. It is not similar to that of lung. Lung, inferior border is circumscribed, but in case of inferior border of heart, the inferior border starts from opening of the inferior vena cava and up to the apex. Close to the apex there is a depression, the notch known as the incisura epicis cordis. It lodges the anterior interventricular branch of the left coronary artery. Next, another ill-defined left border starting from the left auricle up to the apex with convexity towards the left. So, 3 borders, one is right border, one is inferior border and one is left border. There is a ill-defined border, there is a continuation of the inferior border, and this ill-defined border separates the left surface from the diaphragmatic surface. So, now this is the sternocostal surface. As the name implies, it is related to the sternum and the intercostal spaces, and this surface is related to the 3 layers of the pericardium, right phrenic nerve and pericardiophrenic vessels, and mediastinal pleura and cardiac impression of the left lung. Diaphragmatic surface is related to the pericardium, central tendon of diaphragm, liver and fundus of the stomach. Left surface is related to the cardiac impression of the left lung. This is the bare minimum of the external features of the heart. You must remember the sternocostal surface presents an interventricular group, interventricular group. A diaphragmatic surface presents a posterior interventricular group. That's all about the cross feature of the heart.